tell us a little bit about the history of your clinic.
Well, it's really a fascinating history because we really had nothing to do with it. It really kind of originated in the last couple of years with people just feeling uncomfortable with how medicine was changing as far as management and implementation is concerned to patients. And with mandates and requirements, which was completely different than we've dealt with in the past, a number of healthcare professionals, both doctors and nurses, got together September 16th of last year in North Idaho and basically said, well, we feel uncomfortable. What should we do? There should be an alternative. Let's provide some options for patients who might not want to go down certain pathways. And so we met. We really didn't know what to do. And then the only thing we decided was to meet the following week. Well, the following week we met. There were 200 people in the room. We had state senator and congressman and lieutenant governor and all kinds of people showed up for the meeting, and there was a tremendous amount of interest. And a gentleman showed up who has a ministry. He was moving to North Idaho, and he said, I feel as if God told me to help you guys, and I need a headquarters, so I'll buy a medical building and I'll operate out of it, and you guys can lease the rest of it and start a clinic. And so all of a sudden we started going down that pathway, and it just kind of unfolded rapidly, and we opened it in February 1st. It took us a few months to get equipment in, and there's also been a donation of land for us to expand to building another facility, and we've just been growing basically since February 1st, and it's just been amazing. We feel as if we have nothing to do with it. God's doing this, and we're just sitting back watching.
So tell us what makes your clinic different.
Well, what we've done is we're operating on what's called the DPC model, direct primary care, where we function basically taking memberships with people and operate and don't accept insurance or Medicare. So we don't bill them. If people wanted to maintain their insurance, we provide the ICD-10 code so that they can bill themselves if they would like. But everything is run on a membership. And so what that does is that it frees us up so that in essence, we can implement treatments that we believe are best for the patient themselves. And I've got a long history in preventive medicine of over 35 years. So my view in the first place is different than most people. And that allows us to be free to be thinking proactively instead of reactively. And we've had some really great success stories, and it's just fun to be involved.
Janet.
So what is the staff feeling? Because I'm sensing that there's a little bit of excitement, but there's a difference too between where you were before you started and where you are now. So kind of the journey of how people are reacting and how they're feeling.
You mean staff or patients or both?
Staff. Your staff.
It's really interesting because we really didn't know what we were embarking on when we started. It was let's just do something, and that's where it originated. And so there was kind of like it's almost like a panicky situation of what do we do? How do we do it? We've never created this before. It's an alternative pathway. And how do we go about doing this? What's the best way to do it? We were getting a lot of consultation and input, and through a lot of prayer, we finally decided to go down pathways. And with that, with any changes you're going to see, of course, we're going to, people had some perspectives that it should go a certain way and others, but we finally could really see a clear path that was working, that was smooth and operable. And then we brought in people with expertise in certain areas to be able to, handle and deal with those differences and those changes. So we've finally become. It took a few months, but now we're really, operating very smoothly and have some very, very talented people that we're surrounded by that are very gifted. So it's fun.